Welcome everyone. It's great to have you joining us today for a conversation with some colleagues who are offering safe space conversations to senior clinical leaders across the Southeast. And we'll take a moment just to introduce ourselves before we maybe have a bit of a conversation around what the offer is and what we're learning from it. So I'm Ali Jennings. I'm Head of Leadership and Lifelong Learning for the Southeast. And my colleague Fee Rodden.
Hi, Fee Rodden, still Head of Talent for the Southeast, and Ali and I are also co-leading together the Looking After Our People work, which is the health and wellbeing work across the Southeast. I'll hand over to Dave then, if you wouldn't mind introducing yourself.
Hi, I'm Dave Thornton. I work as an executive coach working with individuals and teams, predominantly across healthcare in the UK.
And finally, Peter.
Yeah, I'm Peter Lees. I'm the Chief Executive of the Faculty of Medical Leadership and Management, and delighted to be involved in this really important programme. And I'm particularly delighted to be doing this in the Southeast, where I have form.
Brilliant. Thanks. So we thought we'd start with the first question really being about, so what is a safe space conversation? Peter.
Yeah, thanks, Ali. I mean, it's a very, very simple concept. What everybody recognises at the moment is that there's an awful lot of people working incredibly hard in incredibly stressful situations, and and I've decided I wouldn't use the word unprecedented again, but these are unprecedented times that people are facing. And what we're trying to do with this is give them an opportunity to just take a little bit of me time, look after themselves, and rather than this be a sort of formal coaching process, it has two distinct differences, I think, to that. The first is that this is just an opportunity for an individual to talk about anything that they want to talk about, and that can range over whatever topic is really distressing them or concerning them or bothering them at the time. At its simplest, it's an opportunity to sound off. What we found is that when people do that, that actually very quickly moves into conversations about what they might do about it. And the other thing is that recognizing that people don't have a lot of time at the moment, it is okay to just say, I only want to give this 45 minutes or an hour because that's all I've got. But actually, it would be really helpful to just have somebody that will listen to me.
Brilliant. Dave, so how does the process work then within the conversation?
The process works slightly different to other coaching conversations in the sense that it's fundamentally unconditional support. So in safe space coaching, it's not attached to your performance objectives or the organisation's performance objectives. It's unconditional. It's, as most coaching should be, it's non-judgmental from the coaching point of view, and it's time. It's time essentially, if somebody wishes to be curious about what they might do about things.
I was really curious because I was talking to somebody who's had this in the last week or so, and they said it was a really good space to be cathartic, to get some things off their chest and to share. But also they said the person they were talking to was really well informed and gave them some real practical support, because they weren't really looking for the high reflection at that time. They just wanted some things they could do. So I just wondered whether you'd share about, you said it's not like a traditional model of coaching, if you could just expand on how you have those different approaches and different needs at any given time.
So I'd jump in a bit there, but Dave may want to add to this. I think what we've found in our experience to date is that I suppose if you've just had an hour and you've just sounded off, that might make you feel better. But if you haven't asked the so what question, I think you can end up thinking, well, I've sounded off, but I don't feel very fulfilled now. So I think there's what I've found is that there's a switch in the conversation that sometimes halfway through, sometimes 3/4 of the way through, that says, well, actually I feel better now because I've actually had that opportunity to just get my feelings out there. Because of course when you're looking after everybody else's feelings all day, it's very easy to forget your own. So I've got that bit over, but now actually I need to move forward. And how do I do that? And that's where the experience of the individuals that we're asking to do this, and we are only asking very experienced people to be involved. That's, I hope, where they come in.
Dave, any more from you on that?
Well, we do use that age-old metaphor of, what do they request of you when an aeroplane gets in trouble? Put your own oxygen mask on before you try and help others. And this is a bit of oxygen we can give to people. It's an opportunity to put their mask on, take some deep breaths, and then aid and support either their organisations or their colleagues around them. And for me, if people are at a point where they think they haven't got time for that, or there isn't enough time in the day, etc., that's the very time they do need it.
Yeah. That's really true. It's so easy to prioritize other things, other people, and not prioritize yourself. And I'm probably moving slightly off the question you asked, but I think we acknowledge in this that it is really hard when you're in the midst of something of the magnitude of this to prioritize yourself, to make time for yourself. And it's even harder to take time out. But I think one of the things that Dave and I have found throughout this is that people have got to a stage when they actually have recognized the need to do that. And the feedback they give is that they feel so much better for actually just having moved on. And we've not seen anybody use the word burnout. But we have seen people acknowledge that they become less effective when they get tired and fed up. And the final bit, I think it goes back to Dave's oxygen mask analogy, is that if the senior leadership aren't prepared to do that, then the rest of the organization may not be prepared to do that. So there's a role modeling responsibility in this too.
I think that's a really important point there, Peter, as well, about how you impact on others. So just really curious, because one of the biggest challenges for not just clinical leaders, but particularly clinical leaders, is around how do you maintain your own motivation and positivity without it just being putting a smiley face on when you're kind of burning out inside. So how you create that motivation and hope for yourself, and how you doing that for teams as well.
Oh heavens, I mean, that's a brilliant question, and I've been wonderfully surprised by, because we've now worked with dozens of people throughout the pandemic. And even though they've had the worst times in their careers, many of them, there's not a hint or a question that they're actually going to chuck it in and go and do something else. They're there for the long game. And I hope that encourages people, the whole sort of people coming up behind them, to think that this is such a valuable time. And if you didn't have clinical leaders in this, just imagine where we would be. And I think that's one of the overwhelming things that keeps them going, is just how incredibly important it is. I mean, there's a lot of other leaders. I'm not dismissing what everybody else, their contribution to play. But if you didn't have clinical leaders in this process, where would we be?
Everybody is facing at the moment, but there will be days where it's not that easy to keep going. And just wonder what you are seeing those that you've been speaking to doing to maintain their own genuine motivation rather than that kind of forced continuing.
This is going to sound like self-advertising, but I think one of the things that we've found is actually getting people into the safe space conversation type thing, but something, and I know we've talked about this, and this may or may not be possible going forward, but also bringing people together who are in similar roles in different organizations, we're working with a particularly senior group across the whole of the whole of England at the moment, and one of the things they repeatedly say is it's actually quite affirming to talk to each other. And then, of course, what's wonderful in that is that, you know, people have ups and downs, and it's not the same people that have the ups and at the same time as and then within the group there's a lot of mutual support, and that's, you know, that's just quite simply emotional support a lot of the time, but also some practical examples. And I mean, I've experienced this in my own career. When you know that somebody else is going through the sort of things that you go through, somehow that's reassuring.
Yeah. And I think there's something quite interesting at the moment as well that we've been exploring around the huge opportunities for growth at the moment for people as well, to kind of really be exploring kind of new areas of capability and resourcefulness. Have you come across any of that in the conversations?
I mean, Dave may want to come in on that, but I think one of the things I was going to add to that is that we've been very good at acknowledging very senior leadership positions. I'm not sure we've been as good acknowledging the positions and helping people with the skills and development lower down. And I think some of the people that we've been talking to at a senior level have felt pretty lonely. And I suppose my idea of utopia is that actually the whole medical workforce, taking for an example, the whole nursing workforce or midwifery workforce, comes together as a group, rather than thinking actually you're up there as the leader and I'm here to sort of help or not. And I think we've got to share that leadership load rather better than we have done. And where we've worked with people that have got great teams around them, that seems to work much better than where people feel that they're a bit alone in all of this.
Yeah. For me, one of the key things watching people cope is looking how different people keep their connectivity with others, which, given the world that we're in at the moment, isn't as easy. It's much more manufactured. It's much more. It's not as natural evolving. So when we're talking about systems leadership, the best thing about system leadership is being out in the system, meeting people, understanding them. Now it's let's establish a Teams discussion or a Zoom discussion, and we'll have that next week. It's very easy to lose authenticity in connections. And that's connections not just with colleagues, but with your family and your loved ones, and you know, people that haven't seen their children for months or haven't seen their. So there's whole about that our connectivity has been interrupted. And part of this process is how can we help that connectivity? How can we connect people that have been having similar experiences to allow them to realize that they're not alone? How can we connect them or just prompt them? You know, I was talking to someone the other week who just in the conversation said, "You're right, I'm going to phone my daughter straight after this." It was like the pace of demand of everything, those little connectivities we have in life are dropping off. And, you know, if one conversation with a coach prompted you to think, actually, I need to phone my daughter, then it's simple, isn't it?
I think that's quite a fundamental thing. A lot of the issues that people are facing, they are simple human experiences, and the real push with this piece that you are doing, supporting clinical leaders, is that those little human simple experiences are going to impact on a very wide group of people. So it's even more important that these clinical leaders are looking into it and that they're focusing on it. So I just wonder, I don't know if that's true at all for your experience with who you're talking to.
I think I might not be answering the specific question, but I think there's one of the opportunities that comes up, and picking up and following on the real theme of connectivity, is that it can be very easy to see people in different organizations or a rung up in the system as being sort of distant people on the end of an email. And one of the things that we've done is bringing some of those, groups of people together with some of the more senior people in the system. And we've had some brilliantly honest sharing conversations. And again, I go back to what I said earlier on, when you know that your peers are in the same, having the same anxieties you are, it's very easy to forget that the people that might be driving the system from a bit higher up the system are having those same concerns and anxieties. And I think that sort of connection is made, I think that's made easier by the virtual environment. And just half an hour with one of those colleagues is worth its weight in gold.
I think just coming back to something that you mentioned earlier, Peter, about just how this raises the importance of really powerful clinical leadership. And I suppose just as we're sort of wrapping up the conversation today, just wonder if you both would explore that a little bit further. So what's really emerging, I think, for clinical leadership at this time, and as we move forwards, I guess we don't move on from the pandemic, we move to a place of integrating what we've learned from the pandemic to take care forwards?
Well, I think this might not make me very popular saying this, but I think we've flirted with clinical leadership in the past. I think we've not taken it as seriously as we should have done. And and I hope we don't lose it now, because the pandemic has made it very obvious that clinical leadership is really important, and it's made it very obvious to people running the system, but it's also made it very obvious to people within the professions who, and looking at my own, haven't always been as supportive of leadership as they might. So I think we've got to hang on to that. And I think that will help us then start to think, how do we develop our pipeline of leaders going forward? And the great thing about that is that I also do an awful lot of work with people in the training grades, a lot of work with those people. They absolutely get this, and they get the need for leadership. So if we can use that as a bridge to recognizing that this is actually important, and it's actually a game that everybody has to be part of. And as you will have heard me say many times before, there is ample research evidence that says if we have better leadership and we have better team playing, then patients are the ultimate beneficiaries.
Mm.
I think what we've seen emerging from the conversations we've had with clinical leaders are a number of themes. And I hope what this initiative that you're providing does is allow people to access a space where they can benefit from that. It informed how we've captured it. So we've captured it in 3 words: proactive, protective, and reflective.
Yeah.
So some people just want to use that time proactively to talk about stuff that's going on around them, that they haven't had the time to just afford a little bit of thinking around a brief strategy to deal with somebody or to deal with something around them. So there's that proactive element to it. The protective element is, and how am I looking after myself? How am I protecting myself here? And it could be my physical health, my mental health. It could be my own values and beliefs that are being compromised because of the ever-changing circumstances around me. So it could be ethical discussions. It could be a range of things that mean something very close to people. And the reflective piece, if we ever move on to that, is the bit that asks, and through all this, what are you learning about yourself? And what do you know you now need to put in place going forward? Because many of the challenges we've got at the minute, yes, they will go away, but they're not going to go away. They're not going to go away overnight. What's your strategies for the future? So let's reflect on what you've learned and build some things in. And I think if people can get any benefit from any of those different elements, people will go away feeling some kind of satisfaction from a process that is designed to support them in whichever way they choose. It's not something from above that says, you need this approach, this kind of coaching is needed for you. Use this time for whatever you want to use it for.
Mm. And that's a really great leadership lesson in itself.
Yeah.
Dave, Peter, thank you so much for joining us to talk about this fantastic and really important work that you're doing. We'll pop the contact details for people onto the slide on the next sort of shot, so that people can get in touch to book a session. I'm sure that what you've just talked about has whetted their appetites to make the time to think about what they're doing. Thanks very much.
And can I just say thank you to you, because to actually have a health and well-being element in the NHS is very valued, and to have the vision that you have of actually supporting people, that should be acknowledged, and it's great to see.
Thank you.